Dr. Steve is talking about getting pregnant.
All right, so we're going to hear about that. I think you kind of know a little bit about that, I guess.
We know a little bit, but we want to make sure that your chances are even better no matter what age you are.
There you go. Plus,
so you're trying to get pregnant? Well, we don't have any problems with that here, but many women do face it, and a lot of times it's not fertility issues, which is good news.
Which is good news, and it seems like your chances change as you get older. So Dr. Steve is here with some advice to help you get pregnant if that's something that you have been trying to do. Dr. Steve?
Hey, good morning, ladies. Good to see you. You know, when couples have trouble getting pregnant, they often resort to fertility treatments. But did you know there are a bunch of other things that you can do on your own first to boost your fertility? OBGYN Dr. Kevin Jovanovich is here with the little things that can make a big difference. Dr. Jovanovich, good to see you.
Thank you.
Good to see you. So let's talk about age, because everyone's thinking, I'm getting older. But here you have Halle Berry. She's 46 years old. She's had her second child. How does age affect fertility?
So it's a common misconception that you can get pregnant at any time, in any place, but actually age, women's fertility is a directly a function of age. Women are born with all their eggs, and as they go through life, the egg function declines. So in your 20s, you have about a 20 to 25% chance of getting pregnant per month. And then it drops in the 30s to about 15% chance of getting pregnant per month. And then after 40s, Halle Berry must have gotten really lucky, because it's not very common to get pregnant on your own without help.
Okay, so there you go. So those are the numbers. Well, besides the eggs and the age and the percentage, timing is also very important too, right?
I call it New York City infertility. Sometimes we're so busy, you don't have the right timing, meaning the right time of the month to actually have sex. So you have a business trip or conferences, and you actually have to, there's only a few days during the month that you can get pregnant.
Oh, okay, so you have to you want to know when that window is, and an ovulator predictor can help you with that. So you got to have sex during that time.
Yes.
How often? That's what everyone wants to know, because you have to have sex to get pregnant.
At least once a day. So not 15 times a day, but at least once a day for at least 3 to 5 days leading up to that ovulation, because the sperm lives about 3 days and the egg lives 1.
Okay, so know when you're ovulating and make sure you're having sex during that time. All right, a little medical, we're going to talk about something called cervical mucus.
Right.
What is that, and what should women need to know about that?
So very confusing, but the vaginal and cervical secretions change throughout the cycle. It's sort of the intended way of allowing the sperm to come up into the uterus. So the cervical mucus is very thin around ovulation and thicker after ovulation. So there are products like PrEP, which actually help thin the cervical mucus to allow the sperm more easy entry.
All right, so it basically makes it easier for the sperm to get there. And so we talk about all these changes that women have to do, right? To check your ovulation, make sure you're having sex during the mucus. Now, guys have to make changes too.
Oh yes, 1/3 of infertility is actually male factor. So if you ignore the guy's side, everything you do for the woman isn't going to work.
Right.
So actually, men need to take good care of themselves. They wear boxers instead of briefs. Higher zinc has been found to actually boost male fertility, because men actually continue making sperm throughout their whole life.
Right, which can get them in trouble eventually later. Dr. Jovanovich, thanks so much for coming in. Really appreciate it. All right, now in the 8 o'clock hour, folks, stick around. We're going to talk to a woman who took matters into her own hands, find out how her discovery can help your plans for having a baby. Ladies, back over to you.
Definitely fascinating here. Thank you, Dr. Steve.
Hey guys, it was 9 years ago when Dr. Lara realized it was taking a really long time to get pregnant, so she took matters into her own hands. Well, now she's here with some advice on increasing your odds of getting pregnant. That's coming up.
Okay, a lot of moms are going to want to hear that one.
Welcome back. You know, with so many stories of infertility out there, like people waiting, people putting their career first, do you ever ask yourself, how far would you go to conceive?
There are so many medical things that are available to people now, which gives them so much help. But there was one woman's story. She was a doctor, and she took matters right into her own hands, literally. Dr. Steve is here now with her story. Dr. Steve.
Hey, good morning, ladies. That's right. After her first attempt to get pregnant was unsuccessful, Dr. Lara Oberlard did some research, and she discovered how to increase her chances of conception. Well, that led to the creation of the PrEP kit. It's called a PrEP Make That Baby Kit. And she joins us now to explain how to kickstart your own conception. Good to see you.
Thank you so much for having me.
All right, so Kirsten mentioned you're a doctor, you're a cardiologist. Yes. What happened when you tried to get pregnant?
So I had tried for about 4 months, was not successful, and I was getting a little concerned. I did a little research and read about something called mucolytics, which can be found in some cough syrups. Mucolytics thin out the mucus in the lungs, as well as mucus all over your body, including your cervical mucus. Cervical mucus is the main barrier between a sperm and an egg. So for the sperm to swim to the egg, it has to swim through cervical mucus. If it's thick or sticky, it could have trouble. So mucolytics thin that out and make that process easier.
Okay, so by taking the cough syrup, right, that was thinning out the mucus. But this product you made called Preg Prep, which you co-founded, kind of like does that without having the problems of the cough syrup,
exactly.
Right?
It's actually natural, it's extremely safe, it's healthy, and our active ingredient is called N-acetylcysteine, which is also an antioxidant, which also is helpful in kickstarting your conception.
Okay, so there's the kit right there. But we have it right here. What else is in the kit? Because we've got a couple of other things. It's not just that, right? What do we have?
The kit has 3 parts. It's really a program. It has our secret sauce, the Fertile Prep.
Secret sauce, like McDonald's.
Exactly.
Okay, got it.
Which has the mucolytic. It also has a prenatal vitamin, tastes good, melts in your mouth, and it has a really nice oil that is relaxing. You can pamper yourself. You know, it was very frustrating when I was trying to get pregnant. People would say, just relax.
Yeah,
which,
just sure.
Right.
Just relax,
it makes you not relax. It makes you feel like you're doing something wrong. So we wanted to give women a tool to relax.
Okay, so that's great. Is this something you need a prescription for? Do you get it at any drugstore? You online? Where do you get it?
We're online at pregprep.com, and on our website we also show all the local pharmacies and stores that carry it. So.
Okay, now you're a doctor, and just for all the doctors and patients out there, should you talk to your doctor before you're doing this? Because it could be something else besides mucus,
You should always talk to your doctor. And if you are truly having infertility issues, you've been trying for a year, this is something you should really talk to your doctor about.
Exactly,
sure.
And a lot of people don't realize sometimes it's the man's problem, not even the woman.
Absolutely.
Dr. Lara Obler, thanks so much for coming in. I appreciate it. All right, for more information, you can log on to our website, pix11.com, for all you need to know about Preg Prep. Ladies, I know neither of you had a problem with any of this stuff.
Well,
there's something about the chair.
A little busy, little water, right? The coffee here.
Don't drink it. Don't sit in these chairs. I'm just curious, Dr. Stephen, Dr. Obler, you had a successful pregnancy. How old is your child now?
I have 3 children.
Oh, wow.
I now have a 9-year-old, a 7-year-old, and a 4-year-old, and I was 40 years old when I had my third kid.
Wow.
First shot with the mucolytic.
Wow, first shot. And hey, I love it. You know, having babies on the dark side
of
40.
That's a great testimonial.
Right?
That's right.
That's about. Thank you so much. All right, great to hear that outcome. All right, in the next half hour here, the Pix 11 Morning News, a Pix tradition for you. Miss New York and Miss New Jersey, they are here live, and we are playing Truth or Dare with them. We do it every time they're here.
That's right. And the newest face that could be added to Mount Rushmore, it is definitely someone you know.
And check out this precious pooch, what he has in common.